Okay, I'm gonna do my newborn physical assessment. First, I'm gonna do hand hygiene, then I'm going to put some gloves on. Okay, to begin, we're gonna start with respirations, which should be 30 to 60 respirations per minute. And then we're gonna listen for the apical pulse, which should be between 120 and 160. You want to listen for a minute, and then you want to take the baby's temperature, either auxiliary or rectally, and then you want to assess for pain. And for a newborn, you assess pain through their cry and their movements. And if the baby is not crying, then they are most likely not in pain. And then next, you want to assess the baby's weight. For mothers, they want pounds and ounces, and for us, we want kilograms. So you would assess both. Next, you want to measure the baby using a measuring tape. So you would measure from the head to the heel, and you would measure that in inches and in centimeters. Next, you want to assess the baby's skin color, the texture. So skin color should be pink and evenly distributed all throughout the baby's body. Texture should be smooth. You want to assess baby's trigger on the hands and the feet. Note that for preterm babies, their skin will be thinner, so you want to be careful when assessing trigger. And then you want to assess for the lanugo, I can't pronounce the word, sorry. It's the excess amount of hair on the baby's arms or chest that may not have fallen off after delivery just yet. And then you want to assess for rashes on the back or the face or the chest area, along with checking the buttocks and back for Mongolia spots. And then while assessing the overall skin appearance, you might find vertex, which is a white curd-like substance all over the body, which is used to maintain the body's moisture. So you do not want to remove that, even though some mothers might want to. It is very good for the baby. Next, you want to assess the reflexes. So you want to assess their blink, which you can use by a light. When you put it in front of their eyes, they should blink, and you can also assess for their pupillary reflex while doing that. Next, you want to assess for the startle reflex, which is where you have the baby like this and you drop them suddenly, and then their arms and their legs should spread out. Next, you want to assess for rooting, which is where you get your finger and you put it on the edge of their mouth and slide it down their chin, and the baby's face should follow with their mouth open. You want to do that on both sides. And while you're there, you want to assess for sucking. So you can do that by sticking your finger in their mouth to see if that sucking reflex takes. And then you can also reach further and assess for their hard palate and soft palate and see if there is any cleft, which I do not feel. And then you can also assess for their tongue. You want to assess the color, the texture, and the size. Is it freely movable? And then you want to assess their palmar grasp, which is where you stick the fingers in the baby's hands and they should grasp onto it. And then you want to do the same thing for their feet, which is plantar grasp. And then while you're at their feet, you can assess the Babinski, which is the upside down J. And when you do that on both feet, their toes should spread. And then after that, you can assess for stepping, which is where you hold the baby up and their legs should move in a stepping motion. And then you want to assess for tonic neck or fencer, which is where if you move a baby's head one way, their arm and that same extremity to that side should spread out, as so. And then you want to flip them over on their stomachs. And then you want to assess for prone crawl, which is where the babies are on their stomach and they lift up their butt slightly to try to scoot forward. And then while you have them, you can assess for trunk incurvation, which is where you get your finger and you slide it down their side and the baby should turn to each side. You want to do that to each side. Next, you want to assess the head for general appearance, movement. Are they able to move it freely? Is the size appropriate? We've already measured the circumference in centimeters. You want to assess for molding of the head. You want to palpate for the anterior and posterior fontanelles, which should be flat. You shouldn't feel any bulging. Next, you want to assess for cephalohematoma, which is an accumulation of blood on the head. And next, you want to assess for the caput succedaneum, which is the cone-like shape of the baby's head, which I do not see. And next, you want to assess the face. Is it symmetrical? If forceps were used during delivery, you want to assess the cheeks and the side of the heads for marks or lacerations, maybe even bruising from the forceps, which could also lead to nerve damage of the facial nerves. If the baby was assisted via vacuum, then you want to assess any part of the head for a hickey-like structure from a buildup of suction. And then on the baby's nose, you would see milia, which are small sebaceous glands that have formed on the nose, which you do not want to pop or remove because they are harmless and good for the baby. Next, you want to assess the mouth. We've already assessed the palate, soft and hard palate, and the tongue for movement, size, and texture. So the tongue size is appropriate. Baby is able to move it freely. Next are the ears. Are the eyes symmetrical? Do the eyes line up with the ears? Which is what you want to look for the external ear. If the eyes do not line up with the ears, or the ears are lower, it may mean some kind of genetic deformation. And then to assess a baby's hearing, typically a baby can identify its mother's own voice, so maybe you would ask the mother to call out for the baby or say a simple sentence, and the babies should follow the voice. When assessing a baby's eyes, you want to assess the placement. Are they symmetrical? Are they close together? Are they far apart? What is the color of the eyes? Our baby's eyes are blue. You want to assess for eyelids. Maybe the eyelids are hooded. You want to assess for movement, which we did with the pin light. The baby should be able to follow the light. You want to inspect the corneas of the eyes and the sclera. The sclera should be white. We already assessed the pupils. The pupils are equal, round, and reactive to light. You want to inspect the conjunctiva, which should be pink. And vision, whenever a mother is holding her baby, the baby is typically only able to see as far as the mother's face is. So anything further than that, the baby has a hard time following or seeing. You want to assess for the presence of lashes and the baby's lacrimal glands, which are their tear ducts. Then you want to assess the nose of the baby and for its patency. So you would do that by occluding one nostril and feeling for the air in the other. Babies are typically nose breathers, and you would do that for each nostril. And if you want a better assessment or you're worried about that assessment, you would maybe close the baby's mouth and then redo the patency. Next, you want to assess the neck. So you want to assess the appearance. You want to make sure there's no extra nuchal folds, which may indicate Down syndrome. Then you want to make sure the head and the neck is freely movable. And then you want to assess the clavicles. When you assess the clavicles, you want it to be smooth. You do not want to feel any bumps or bulges, which may indicate a break in the clavicle. And then you want to assess the chest. So we've already measured the chest circumference, and the appearance appears to be symmetrical on both sides. Then you want to monitor for expansion when breathing with respirations. You want to note if there's any retraction, which would mean that the baby is struggling to breathe. And retraction means that the baby's using all of its accessory muscles in order to breathe, which is a bad sign. When auscultating lung sounds, we've already done that, and the lung sounds were clear. And it's not abnormal to hear wetness when auscultating lung sounds because the baby is still trying to get rid of fluid from the lungs that it had before delivery. And then when we've already measured the chest, and if for a preterm baby, the chest would appear flat with no breast development, but for a term baby, the breast buds may be slightly elevated, which you can measure in millimeters. And then heart sounds were heard. S1 and S2 was clearly heard, but it is not abnormal for a murmur to be present after birth. Just be sure that if it is heard, to document and notify healthcare provider because it may or may not go away. When assessing the abdomen, we have already assessed the circumference. The general appearance is smooth and the color is evenly distributed. You want to assess the umbilicus as well. Is it clamped? Is the wart and jelly still present? Or is it drying out? You can also palpate the heart rate at some times through the umbilicus. So can you do that? You want to assess the femoral pulses, and then you want to assess the inguinal areas in case of an inguinal hernia, and then accessing the extremities such as the hands, arms, feet, and legs. Baby has 5 fingers, 5 fingers, 5 toes, 5 toes. Hands and extremities do not appear to be blue or cyanotic. When assessing for jaundice, you want to assess the baby as a whole. Is it just at the head or is it from head to toe? If it's just the head, then it'll be physiological, but if it's head to toe, which is a late assessment, it may be pathological and be a sign of a disease process. And the baby is not able to break down bilirubin properly. Next, you want to assess bowel movements. So there are 3 different kinds of bowel movements that a baby can have. The first one is the meconium, which is that black tarry substance, which is usually the first and second bowel movement the baby has after delivery. And then after that, if the baby is breastfed, it'll be a yellow, like liquidy, and it wouldn't have a foul odor. And if the baby was formula fed, it'll be a more formed stool with a foul odor. And then when assessing urine, you want to assess the color, the odor, the frequency of the voids. So By day 1, you would want 1 void, day 2, 2 voids, 3, 3 voids, and so on. By 1 week after birth, you would want the baby to have 6 to 10 voids in a day. And now we want to assess the baby's genitalia. I have a female baby, so we would assess the mons, the vagina, and the clitoris. Make sure they're all present. And if it was a male, you would want to assess for a penis, scrotum, and testes. You would assess the testes through the scrotum, and they should feel almond-like. You just want to assess if they have dropped or not, and if they are present. And for babies, you want to flip them over and assess their buttocks. You want to assess for symmetry. You want to assess the anus to see if it is patent or not, which would be evidenced by a bowel movement. You also want to see if there's any lesions, skin tags, or tears in the anus. And a baby's cry should be strong, a moderate tone and pitch. And then the length of a baby's cry should last from 3 to 7 minutes after consoling them. And you always want to make sure that a baby has a bowel movement and urinates before discharge. And I believe, let me make sure I didn't forget anything. I believe I got everything, and that is it.